Hello, my name is Morine. It is my pleasure to present to you a study that we have done entitled Increasing Data Sharing for Social Good, Lessons from Africa's COVID-19 Response. I had the privilege of working with Jessica and Professor Neil, both from the University of Cambridge on this study. And this work has been made possible thanks to Data Science Africa's Visiting Research Fellowship Initiative. My presentation will take on the following shape. I'll start by taking you through Africa's data-driven COVID-19 response, where I will share some summary findings. Then I'll talk a bit about Africa's data policy agenda and the importance of this study, followed by a showcase of challenges that affected data sharing and areas for action that have been identified by the study. And finally, we'll look at recommendations and pathways that this study has made. So let's get right into it. Like in other parts of the world, COVID-19 intensified the need for timely data and information for decision-making to aid intervention. A concern for many governments, as cases spread across Africa, was the ability to access data to rapidly inform policy responses. And this increased focus on data collaborations across sectors and organizations. It resulted into a variety of data-driven initiatives. What you're looking at is a landscape of data-driven COVID-19 solutions by country as per the data that we collected. The bigger the dot or the circle, the more solutions are found in that country. So for example, you realize that South Africa, Ghana, Nigeria, Uganda, and Kenya had a significant number of data-driven solutions that were developed on the continent. Here is a breakdown of data-driven solutions by data type and then also by sector. You realize that, unsurprisingly, COVID-19 statistics made up the most data-driven solutions, and this we saw in terms of data dashboards or COVID-19 updates that come, or dashboards that were published all over, showing statistics such as the cases of COVID-19, the death rate, and the vaccination, and many other statistics. This was followed by mobile phone data, but then we also realized that there were quite a number of webinars, articles, and AI-enabled solutions that were developed for the response. We also had solutions that were developed based on survey data, financial data that I was looking at, at survival rate of businesses during or after COVID. And then also there were some solutions based on social media data, which were looking at things like infodemic management. Then there were cases of search, Google search data, and news data. For sector, we realized that we found out that private sector developed most of the solutions on the continent, but then also NGOs and government had a huge percentage of the data-driven solutions that were developed. Overall, we found that the following areas were impacted by data during the response. First was tracking and prediction, followed by situation updates, contact tracing efforts, population, health facility, and capability management, among other things. Having realized that all these data-driven COVID-19 solutions are a trove of information, constituting experiences of deploying data science, data policy developments that include valuable lessons that can advance the sharing and use of data for social good beyond the pandemic, we set out to carry out this study. But first, let me take you through Africa's data policy agenda and what makes this study important. Whereas there are still significant data policy gaps in most African nations, national efforts and legal and domestic legal frameworks are gradually increasing, addressing issues in areas such as digitalization, data production, data governance, and data reuse, which is a step towards data-driven policy making. Here are a few instruments that have been referenced in our study that show the interest in increased data use in policy making for Africa. They include national development frameworks, data revolution policies, Africa Data Leadership Initiative documents, and then African Union Agenda 2063, and the recent released AU Data Policy Framework. In fact, we believe that Africa's data agenda plus the need for effective pandemic response, that is the need for timely data and information to aid interventions for COVID-19 response, is what resulted into an increased data-driven crisis response in Africa. So our motivation was to derive lessons from the COVID-19 response that can inform future data sharing and use initiatives. We wanted to derive lessons from the experiences of data-driven solution providers, enablers, data producers and curators, coordinators and decision makers from government, academia, NGO and private sectors. And we were hoping that their experiences we can derive lessons from their experiences and make recommendations that can increase data sharing beyond the pandemic. In short, the study was an intentional effort to examine what worked for the COVID-19 response that can inform future data sharing and use initiatives. Here is an illustration of the approach that we took. We first collected data about data-driven COVID-19 solutions in Africa, and we used a survey and did an extensive online search to collect this data. Next, we identified practitioners that deployed data science for COVID-19 response. And then the next step was to convene them for a workshop, during which we investigated further their experiences in using data for the response. We then engaged a few of the practitioners even further, and this helped us identify case studies that we have featured in the study, as you will see in the next presentation, in the next slides. So in summary, we looked at 74 data-driven COVID-19 solutions from 45 African countries, and we engaged 22 practitioners. The case studies that we featured in the study are 3. The first one being about leveraging existing partnerships to access data. This is a case of Ghana Statistics Office that had a partnership with a telecom company as a data provider and a development partner organization that was playing the role of a solution provider or the developer. And so having had an outstanding agreement prior to the pandemic that was about sharing data for development, they were able to leverage that engagement to quickly access data for the COVID-19 response. And they were able to come up with solutions to do with contact tracing, population mapping. The next case study that you will find in the study in this report is going to be one about government campaigns that resulted into national data hubs. Several countries, including Nigeria, Namibia, Zambia, and a few others, were able to develop data hubs because their governments made an effort to get stakeholders to work together for the sake of responding to the COVID-19 pandemic. The last case study that we highlight in the study is one of a convening partner supporting data access and sharing approaches. This is a case of Global Partnership for Sustainable Development Data, who partnered with the UN Economic Commission for Africa, and they were able to engage over 50 African governments, bringing most of them together with other partners that ended up developing data-driven approaches for the COVID-19 response. From the analysis that we have conducted, we looked at case studies like the ones we've mentioned above, but even more initiatives that we collected. And we were able to identify some of the challenges that still hindered or were an obstacle to data sharing and data use for the crisis response and development. And we've also established areas where specific action can be taken to increase the use and sharing of data. And so let's briefly go through those. So challenges, the first challenges that the first challenge that we came across was one of data literacy. This challenge was evident where key stakeholders were unaware of their roles in the data ecosystem. They did not know the value for data and how even to achieve that value. We talk more about this in the study and even give specific examples of the challenges that came up about because of the data literacy, of the low data literacy. The next challenge was in the area of data governance capabilities. And with this, we found many cases of inexistence of trustworthy data governance, addressing privacy issues, accountability, incentives, and many other challenges that were faced by people who tried to develop data-driven solutions. And finally, there was an issue when it comes to partnership building. We realized that where there were no partnerships before the pandemic, data access and sharing initiatives took a long time or even never happened. Now, from studying these areas that were a challenge for solution providers, we were able to come up with 3 areas where specific action can advance data sharing and use for social benefit in the longer term. And the first one is the area of an area that we have called institutions. Now, when we talk about institutions, this constitutes state and non-state institutions at national and regional levels, playing the role of enablers, and they provide structure and incentives for handling the data life cycle. The next area for action is platforms, platforms where stakeholders can engage, and these are spaces to explore opportunities for collaboration, playing the role of coordinating counterparts and also coordinating resources. Finally, we realize that people make a huge impact in the data ecosystem. Realize that the diversity of roles and responsibilities played by people in the data ecosystem and the skill set that is needed for these people to play these roles is an important area to pay attention to. So having identified these areas, the next step was to make recommendations that sort of speak to these areas for action. And so let's get into the recommendations. We made 4 recommendations from this study. The first one was to improve data awareness and data governance capabilities, followed by building long-term institutional partnerships. The third is to set up engagement platforms on the data agenda that last beyond a particular cause. And finally, is to amplify examples of data sharing, access, and use for policy making during the COVID-19 response, and use them to inform similar practices. Now, for each of these recommendations, we went ahead to say, to see who are the actors who can do this, who can, let's say, who can improve data awareness and governance capabilities. So in this slide, I'll take you a bit through who the actors are, and then also how actually they can learn, what they can learn from the COVID-19 response, and how they can grow, improve data awareness and data governance capability. So the first actor for this recommendation is national statistical offices and policy makers in sector ministries. And how they can improve data awareness is by upskilling staff at all levels. We realized that you will find that people at the National Statistical Office could be aware of data and data abilities, but then people who are dealing with the grassroots at the lower level do not understand the importance of collecting data in a particular way, in a forward-looking way. So one way that we can improve data awareness is to upskill staff at all levels, and we found that that can be done mostly by national statistical officers, but also policy makers in sector ministries, since these are represented all the way to the lower levels. We also realized that development and implementation partners, civil society organizations, academia and donor institutions have a role to play in improving data awareness and governance capabilities. And how they can do that is by conducting studies that can be used to equip and support national statistical offices to prioritize the data agenda. But then we also realized that both actors have a role to play in creating avenues for those producing evidence to get it to decision makers. So an example that I can give you here is one thing that we try to do while collecting and analyzing our data was to find out the usage of the data-driven solutions that we collected. So by this, I mean, we would get the name of the data-driven solution, but we'll also get what we call the level of use. Is it in use? Is it a prototype that is ready to be used but is not being used? Is it a prototype that is not ready to be used, or is it in development? And we found that a significant number of solutions were at a level of a prototype ready to be used, but they were never used. Why? Because they never go to the decision makers. So we believe that it is a role of national statistical officers, policy makers, but also their development and implementation partners to create avenues for those producing evidence to get it to the decision makers. I will give you also another breakdown of how to amplify examples of data sharing across, access, use for policy making during the COVID-19 response, and use them to inform similar practices as a recommendation. So here we realize that all actors across the data value chain in the data ecosystem, including research communities like Data Science Africa, advocacy groups, and organizations propelling the data agenda, had a role to play when it comes to amplifying examples of data sharing, access, and use for policy making. And how we believe they can do that is communities and organizations pushing the data agenda can amplify the impact of data-driven COVID-19 solutions through research and continued dialogue. And I'm happy to note that Data Science Africa is actually doing this in a way that we're able to showcase what is working, what has worked, to continue dialogue around the area of data. And so for each of these recommendations that we made, in the paper, we go and break down exactly who the actors are and what are some of the actions that we can do. And now, allow me to take you through, try to attach some of the recommendations that we have made to the specific areas for action that we went through earlier on. So, for example, for institutions, the recommendations under institutions would be to improve data awareness and data governance capabilities, and then build long-term institutional partnerships. And then the recommendation under platforms would be to engage in long-term commitments, not specific to one cause. So this came up in a way that you find people come up to respond to COVID-19, but then after the pandemic has ended, then the collaboration sort of ends. Yet these can be leveraged to build long-term commitments, to use same data, same approaches that have worked in order to respond or even to deal with some of the development challenges that we face. And finally, for people, we realize that there is a need to review and refine roles and practices from the COVID-19 response to better scale different actors. Again, different types of people play different roles in the COVID-19 data-driven response. So being able to learn from them, refining the roles, and then making sure that this is made a bit structural would be a good step in enabling people to be enablers of data sharing. So finally, what I'm going to take you through is going to be the different pathways that we have identified that can directly impact data sharing beyond the pandemic. So these have been, the pathways have been broken down into two broad areas. The first being about best practices to adopt. The second one being ways to increase collaboration, since those are some of the recommendations that we have made. So on the first one, best practices to adopt, the first move would be to adopt successful data governance mechanisms and data privacy and protection measures and tune them to fit data for other social needs. The second would be to build on the foundation of existing and successful partnerships and relationships. And finally, is to build on commitments and momentum from the COVID-19 response and encourage partners to support other social causes that can benefit from the partnerships and data exchanges that have been set up for the COVID-19 response. In a way to increase collaboration, we realize that there is a need to review and refine partnership structures and then even secure more partnerships. Finally, we realize that there is also a need to credit and encourage new forms of data collaboration by policymakers. And so those will be some of the pathways, the recommendations, and the summary findings that we got from this study, and that you can find more in the discussion paper that has been submitted, and the full paper that we hope to be published soon. Thank you, and that's how you can stay in touch with me.